Welcome to the Nutrition Research Update from the Renaissante Institute of Integrative Medicine. I'm Dr. James Meschino. Our topic today is low back disc herniation. So with low back disc herniation, there are symptoms that can be, very mild to very severe, such as not only back pain, but also pain in the buttock, pain down in the back of the thigh, pain that reaches the knee, and then it becomes a more serious situation if the pain goes below the knee. This is when you start to really suspect there may be some herniation going on, or that's a possibility. It can also go down to the foot. Not only can you have pain, but you can have tingling, numbness, some significant muscle weakness, upon neurological examination, some reflex changes that the doctor might find. So the symptoms can be quite mild to very incapacitating, actually. But you have to differentiate between a disc herniation and a disc protrusion. So with a disc herniation, also known as a prolapsed disc or a ruptured disc, that's different than a disc protrusion where the disc is just bulging, which is less serious. So here's how the disc is put together. Around the outer fibers of the disc are these fibrous rings. And in the center of the disc, there's like a jello type of material that's very gelatin-like. And so the fibrous rings around the gelatin in the center sort of keep the gelatin in place, and that gelatin is a shock-absorbing component of the disc. When you have a herniation, you actually have tears in the outer fibrous tissues, and the gelatin sort of works its way through those tears and will actually bulge beyond the outer borders of the fibrous rings, and usually that happens in a backwards and sort of side direction, which puts pressure on the spinal nerves as they're exiting the spinal canal, and that nerve pressure can create a lot of pain and some really debilitating symptoms. So a lot of that pain is coming from direct pressure on the nerves by the gelatin that sort of escaped through the tears in the spinal disc in a disc herniation. Now, disc herniations are normally a further development of what was a disc protrusion. So a disc protrusion or a disc bulge is sort of the thing that most people have that can lead up to a herniation if it's not managed properly. So what's a disc protrusion? That's where the outermost fibers of the fibrous ring are still intact, but they bulge a little and may put a little bit of pressure on the spinal nerves or create some inflammatory process, but the gel in the center is not actually escaping and actually rupturing through the outer fibers of the fibrous ring. So a bulge is less serious than a true herniation or ruptured or prolapsed disc. So what's important to know is certain things that you do in your life can actually put more pressure on the disc and increase the likelihood you're going to force tears in the outer ring and cause the gelatin material to actually force its way through those tears and create a herniation. So long periods of sitting are linked with more disc pressure. When you're bending forward, you put more pressure on the disc compared to leaning backwards. And a lot of occupations or recreational activities where there's repetitive bending, like shoveling or gardening, many other occupational activities where you're bending, then you're coming back up, you're bending, you're coming back up. This repeated pressure on the disc can create tears over a period of time, or bulges in the disc, and may set the stage for some of the gel material to escape and create a frank herniation. Sitting and leaning forward puts a lot of pressure on the disc that may cause a bulging disc to weaken further. The good news is that conservative treatment for disc protrusion is highly effective. In fact, studies show that chiropractic treatment is extremely effective for disc protrusion, where you have just a bulge of the disc to try to correct that so that it doesn't become a more serious problem down the road. And some chiropractors will recommend traction or decompression, exercise therapy, soft tissue treatment. All these things work synergistically to produce a very good outcome. With disc herniation, sometimes it heals and sometimes it's so severe it actually requires surgery. Now, many minor herniations actually heal just in a number of weeks with bed rest and conservative treatment. And most of the pain in a disc herniation in the beginning are really coming from the release of inflammatory chemicals. But when you have severe herniations where the gelatin material has escaped quite significantly, there's a lot of pressure on the spinal nerves, you can have really incapacitating pain, which may in fact require surgery. And when the pain is below the knee and there's weakness of the muscles, and there's reflex changes occurring when the doctor does the exam, and it's very severe and incapacitating, these are the types of herniations that usually require more immediate attention. Now, most low back pain actually doesn't come from disc herniations. Most of the back pain that we have, the garden variety back pain that we feel, usually the joints of the spine are actually misaligned or they're locked together. These are called the facets, and they sort of jam, that irritate some nerves. There's muscle tension around it or contractures, and there may be some minor disc protrusion associated with that. And that's the good news, because that can be treated highly effectively with conservative management. Chiropractors are experts at treating that type of problem. Some low back pain sometimes just is caused from spasm and irritation. And sometimes where the pelvic joints meet the spine, these are called the sacro-iliac joints, they can shift and cause nerve irritation that can look a lot like symptoms you'd get in a disc herniation, but it's actually coming from the sacro-iliac joint. And chiropractors are experts at identifying that. And the truth is that chiropractic treatment has been proven to be in clinical studies the most effective treatment for treating these common low back problems, including disc protrusion or disc bulges. So facet and spasm problems are usually caused by repetitive lifting or twisting motions, repetitive activities, or even from a specific type of trauma or sports injury, and sometimes from just unknown causes. But again, chiropractic care is the best suited treatment for getting people out of pain quickly and back to their normal occupation. Not just covering up symptoms with drugs that mask the pain, but correcting the underlying problem. That's really what you want. Now, in terms of disc herniation and the aging process, it's interesting to know that most serious disc herniations occur in people who are in their 30s and 40s. As time goes on beyond that point, the gelatin material inside the disc tends to dry out and harden, and so there's not much of a risk that that gelatin's going to escape and produce a true disc rupture. So as we get older, disc herniations are reduced. In people's 50s and 60s, a lot of low back pain becomes due to arthritic changes in the spine, osteoarthritis, and degenerative disc disease, and even a condition called spinal stenosis that can also produce some low back pain, leg pain. And so it takes the right diagnosis to differentiate the type of back pain you're actually getting. Again, the signs and symptoms of a disc herniation, there may be little or no pain if just the outer fibers are slightly bulged, or it can be really severe and incapacitating if you have a really frank herniation and you have these symptoms into the leg with reflex changes and weakness. And again, other symptoms can include numbness, tingling, paralysis or paresthesia, this sort of strange sensation like needles and pins when someone touches your skin, and other sort of neurological symptoms. Typically with a disc herniation, it's only going to affect one side, so you're not going to feel it in both legs. Usually you're going to feel it more on one buttock, one thigh, one leg, down to one foot. And really, non-surgical methods of treatment are usually attempted first. Surgery is usually the last resort. A lot of medical doctors will prescribe pain medication in the early stages just to alleviate the acute pain and try to let the disc heal with some conservative treatment. But we're seeing there's now evidence that inflammatory chemicals that are released during a disc herniation are largely responsible for a lot of the pain. And so rather than the pain being only due to pressure on the nerves, sometimes just the disc bulge and the facet irritation and the muscle spasm are actually releasing chemicals that produce an inflammatory response, and that gives rise to pain. In fact, there's evidence that a particular type of chemical is released called tumor necrosis factor alpha. We just call it TNF. TNF is released not only by a herniated spinal disc, but also in a disc protrusion when there's just a small amount of bulging, when facet joints become irritated, and in spinal stenosis we see that you can start to get this type of chemical being released. So what the good news is that there are certain types of dietary and supplementation practices that can go a long way to helping to reverse that and get you back in a situation where you can suppress that inflammatory chemical. So what really matters in the end is that you get the right diagnosis. So the diagnosis of back pain requires the proper physical examination. There's a certain battery of tests that can determine disc protrusion, from disc herniation, from sacro-iliac, from facet irritation, from a muscle spasm. And chiropractors spend 4 years just studying that, so they are well equipped to do that assessment. They're highly trained in this area. And it may require some imaging, like x-rays or a CAT scan, maybe an MRI is sometimes necessary to get a good look at the disc. And even nerve conduction studies can tell the practitioner a lot about how the nerves are behaving. But in addition to all that neurological and orthopedic stuff that goes on in the diagnosis and the types of treatment that are available, conservative management, chiropractic care, the nutrition and supplementation support is emerging to be very important in the long-term management of these problems. So we're seeing that certain types of nutritional support and supplements can help to support the spinal disc and suppress the inflammatory process. What are those things? After age 40, everyone should take a supplement that contains glucosamine with 3 anti-inflammatory herbs, MSM, quercetin, and bromelain. It helps not only to support the disc structure so it doesn't degenerate so quickly, but it also helps to suppress inflammatory chemicals that normally get released in the aging process. When you do have an inflammatory flare-up, there are natural anti-inflammatory herbs that can suppress the release of TNF. Remember I told you that when you have back problems, tumor necrosis factor alpha is secreted. It produces a lot of the inflammatory and pain-generating pathways. It can be suppressed with certain natural inflammatory herbs like curcumin, boswellia, white willow bark extract, and ginger in a combination supplement. That way you don't have to use as much aspirin and ibuprofen, things that will damage your stomach and your kidney and your liver and actually hasten more cartilage degeneration. And using the right combination of essential fats. A lot of people take essential oils, evening primrose, salmon oil, flaxseed oil, but the best combination is actually fish oil with flaxseed oil and borage seed oil to produce these anti-inflammatory prostaglandins that are proven to also suppress the inflammatory process. And to make all of that work really well and to support the spinal disc and muscles and connective tissue, you need a high-potency multiple vitamin, and you need to be on an anti-inflammatory diet. Now, some other measures that are useful: the right exercise program for strength training, the right flexibility program, possibly massage therapy, and other things to release some of the muscle tissue. Sometimes electroacupuncture is highly beneficial in interrupting the pain spasm nerve cycle. So your chiropractor may recommend some traction or decompression, maybe some massage therapy, some electroacupuncture. They'll probably design an exercise program in conjunction with the appropriate treatment that's being rendered in their office. Now, because the nutrition and supplementation aspect of it is the part that's not largely known, in the text below you will see the exact diet and supplementation program to help suppress spinal inflammation and support the structural components of the spinal disc that'll help to prevent disc degeneration as you get older and support the integrity of the spinal disc over your lifetime. And again, if you have problems, then suppressing the inflammatory process is vitally important. So I hope you found this to be useful and informative. If you have low back problems yourself, you really should see a chiropractor and follow the dietary and supplementation advice that I'm showing you here. If you know someone who does have a problem like this, please forward this newsletter to them so they can see it and evaluate the information for themselves. So thanks so much for watching, and I'll see you next time.